Today on Beyond the Image, I'm sitting down with SDMI founding partner and president, Dr. Mark Winkler. Thank you for joining me today, Dr. Winkler.
You're welcome.
So I'd like to start with the history of SDMI and how you became a part of this organization, what brought you to Vegas, to radiology.
Steinberg Diagnostic Medical Imaging was the very first outpatient-based practice in Nevada, and today is the only major outpatient practice which remains in private hands, still owned and managed by local people rather than by Wall Street. And that's very important because it allows us to concentrate on quality rather than trying to concentrate on profits for Wall Street investors.
What did radiology look like when SDMI first started?
When SDMI first started, radiology was very different than what it is today. Radiology was kind of an analog thing. Think of cameras with film. So patients were dependent upon getting those films produced, having to come pick them up and bring them to their doctors. Today, SDMI is at the forefront of radiology in the cloud. Everything is digitized. So once you get your study done, you can immediately access it online. You can send those images anywhere you want by yourself in the world. Your reports are available online, and your physicians can independently access all of that data almost instantaneously. So the practice has really grown from sort of the old school analog images to a completely cloud-based, patient-driven practice. And along the way, the technologies that we use to take the pictures have dramatically changed as well.
Tell me about your first encounter with MRI.
My first encounter in MRI started in medical school in the early 80s. I was doing research work in the Department of Nuclear Medicine, and the physicist there introduced me to this growing technology. And really at that point in time, I chose to go into the field and chose training programs that were going to allow me our early experience in MRI. The program I went to along with David was in San Francisco, University of California at San Francisco, and they were really the national leader in MRI technology. And I stayed on and did a fellowship in MRI and eventually became clinical director of the MR research laboratory there. At the same time, David went to the East Coast and was sort of the leading edge of interventional radiology at the program that he went to. So really what happened was we discussed in training together someday forming a practice together, kind of the two of us together with his interventional skills and my advanced imaging skills, kind of made one modern radiologist. And his father, Leon, really wanted to get his son back in Nevada. And so David and I came and joined him and started SDMI in the late 80s.
How has the technology, we'll stick with MRI as a good example, how has that technology evolved over the years?
MRI does not look at all like it did 30, 40 years ago. So the technology is much, much faster. At the same time, the kinds of images we can are far more diversified. The quality is much better. The kinds of studies that we can do are much, much more sophisticated. So the technology is really rapidly advanced over the last 3.5 decades and continues to advance. Image quality is getting higher and higher. The variety of studies we can do is getting wider and wider. The pictures are better and better, and very importantly, from the perspective of the patient, the studies are much, much faster.
So as a patient, what should they be looking for when they're seeking out a radiology facility when it comes to technology?
You should be looking for a practice which is constantly updating their technology, has a wide variety of devices so that they can get the optimal study for the kind of procedure they need. Some machines do one body part well, other machines do another body part well. We're in a very fortunate situation at SDMI because I was running the research and development facility in San Francisco. I kept those industry ties, and we are able to get newer equipment much earlier than most other people. So we have a remarkably sophisticated set of technology at SDMI, not just the imaging equipment, but also the IT infrastructure across the board to make we have better studies than we would otherwise be able to have. We have a better patient experience because of that, whether the machines are more pleasant or they're faster or they're better. We have a better IT experience. At SDMI, everything is kind of vertically integrated. So we do everything in-house, which leads to better integration, better quality, and faster turnaround. When I say everything, I mean we run our own construction teams. We basically acquire the equipment ourselves. We train the technologists ourselves. We literally do everything. We have our own machine shops. We run our own maintenance crews. We run our own landscaping crews. So we're a very integrated practice, and that just allows us to provide better service, across the board.
How often should a piece of equipment be changed out?
The pieces of equipment can last a number of years as long as you're investing in upgrading them like we do. In general, equipment can last anywhere from 5 to 15 years, but you want to be constantly upgrading that equipment. Our most recent pieces of technology all come with obsolescence protection clauses for 7 years, which means during the lifespan of that equipment that we're constantly getting the newest hardware and software available for that. So even if we had a piece of equipment that's 7 or 10 years old, it's still effectively a brand new piece of equipment. But it's important to change the technology because, just like changing your TV into better quality TV, or changing your iPhone, or changing your personal computer or your laptop, you want the best in a rapidly evolving field. And medical imaging is sort of at the forefront of changing medical technology.
We talked a little bit about MRI. What are some of the other modalities that you've seen drastic changes in over the years?
Well, virtually everything we have has drastically changed. Originally, mammography was basically on a film. Today it's done digitally. It's not only done digitally with a single image, we're now doing volumetric 3D imaging in mammography. In addition to that, we have AI supplementing the radiologist's interpretation to make sure that we can depict as many cancers as humanly possible. So mammography has basically gone from film to 3D digital with AI augmented interpretation. CT has rapidly changed. Originally, we could do one CT image at a time. Now we have technology, particularly for the coronary CT angiograms, where we can do hundreds and hundreds and hundreds of images in 1 second. So that technology has undergone rapid evolution. The CT technology has undergone hardware and software changes, so we're using just a small amount of the dose that we used when we started the practice. And we now have AI fully implemented in all of our new CT machines, which allows us to do much lower doses and get much better pictures. We have digital nuclear medicine studies now rather than analog PET, for instance, and so those are infinitely higher resolution, much better quality. We still have the only digital PET scanners in the entire state of Nevada, and those products have AI on them, which we're evaluating and trying to perfect. In some of the modalities, we've actually worked to build the AI and pick the actual protocols, particularly in MR and CT. And those AI protocols that we clinically developed are now in use across the world. We're working on AI programs today in PET scanning and also in conventional X-rays, again, to drastically lower the doses. And again, X-ray has been like the other modalities, it's undergone rapid evolution from film to digital, and from digital now we're going to AI digital so we can even further lower the doses.
What is the future of radiology?
The future of radiology, I think we're going to see continued improvements in the technology that we already have. I think we'll see new applications, particularly in cardiac imaging, prostate imaging, breast imaging, which we're already starting to put in. You're going to see a lot of AI in place, not to replace the radiologist, but to either improve the image quality, improve the patient experience because things can happen faster, or to augment the radiologist so we're even more accurate in our interpretations.
There's been a lot of discussion that not as many people are going into the healthcare industry. Not as many people are becoming doctors, and especially not radiologists. What advice or encouragement can you give to somebody who's maybe in medical school who's thinking, is radiology the place for me?
I think radiology is still a very, very dynamic career, whether you're the support staff, you're a technologist, or you're a radiologist. Radiology is still rapidly evolving. Basically, radiology is the IT, the digital technical interface of medicine. And just as your computers are rapidly evolving and your iPhone is rapidly evolving, the same thing is happening in medical imaging. It's going to continue to evolve. As the patient population gets older, as the boomers age, they're going to need more and more aging. So there's certainly there's a very robust career that'll be present in medical imaging, whether you're the support staff, you're the technical staff, or you're the physician.
How do you stay ahead of the curve when it comes to the technology?
We have a tight research relationships with a number of the international vendors, so we get product very early. I'm involved with a number of the vendors in evaluating product before it's ready for marketplace, before it's been FDA approved. So we have an advantage of having a window into the future because we do a lot of research and development through the practice. So that gives us a big, big advantage. So we've really been pushing the technological envelope on lowering dose in X-rays, lowering the dose in mammography, lowering the dose in CT, and lowering the dose in PET scanning. So for example, in PET scanning, the new digital PETs use half the dose of a conventional scan. They take half the time of a conventional scan and are actually at 8 times the resolution of a conventional scan. So there's really no comparison between the technology that we have available at SDMI, particularly in PET, and the technology that anyone else has available in this state.
To a patient that doesn't really understand dosage, why is a reduced radiation dose important?
Reduced radiation dose is important because there are many people, and this is part of our belief system, is that the amount of radiation you're exposed to is related to potential risk from the imaging studies. So if you're getting a lot of exposure from your medical imaging studies, because you have a lot of them, or for instance, you're an oncology patient and need repeat studies, you really want to be imaged with the lowest dose possible so that that radiation presents the lowest risk to you.
What does the future of SDMI look like?
Well, I think that we're continuing to grow in the community. We're continuing to open offices. In fact, we opened 3 offices during COVID, which is probably one of the few practices in the world to continue to open offices during COVID. We have a very long-term perspective. So while other practices are withdrawing from the community or restricting their services or not making investments in the community, we're continuing to do so. We basically opened 1 office for each of the last 3 years. We're looking at several locations to open offices in Las Vegas over the next several years. So, our goal is to be the quality provider in Las Vegas. Our goal is to basically be the academic practice in the state of Nevada, the technologically leading practice in Nevada, the best service provider in Nevada.
What impact do you think SDMI has had on the community?
I think we do about half the outpatient imaging. I think we've had a very positive impact on the community because we've driven the technology in the community. I think the other imaging practices have had to keep step. I think even the hospital-based practices need to sort of keep up with us. So I think we've had a very positive impact on the community. We really want to do a good job. We don't report to anybody else. We report to ourselves. And everybody in this organization at any level understands that we want everything perfect. We want the bathrooms clean. We want the landscaping looking good. We want everything perfectly, everything perfect for the patient experience across the board. And when we see we're falling short, we go to great lengths to improve.
What has been the biggest challenge moving from when you first started and you were a reading radiologist day in and day out to now being more on an operational side of the business?
Well, I wish I were just on the operational side of the business. I'm still a reading radiologist. So, I mean, the biggest challenge has been I'm trying to read because there's a physician shortage, but we're a really big practice. There are a lot of things to keep in touch with. I'm, basically on call 24/7. So the biggest challenge is trying to keep up with the workload at this point.
What has been the most rewarding part of your journey so far?
The most rewarding part of the journey is, when you actually get to interact with a patient and you actually get to help somebody. So, and that's probably the most rewarding experience. So there's really complex cases or those really acute cases where you get to see the impact you're having on someone's life. It's also been very intellectually and emotionally rewarding to be at the cutting edge of technology. Even though we're a private practice, we have a big, development arm, whether it's with the medical imaging itself or the information technology to assist with the patients. And to be at that cutting edge has been very rewarding. We've had thousands of practices from around the world come visit us to see the equipment that we're using, to understand the processes that we're doing, and that's also very intellectually and emotionally rewarding to sort of be a beacon of light for other radiology practices to model off of.
Tell me about one of your most memorable experiences or one of the things that stands out to you the most about your time at SDMI.
The thing that stands out most to me about my time here really are the coworkers, the team members at SDMI. When I first came 36 years ago, we have people who are still with us. We have people's children that are with us now, and now we have people's grandchildren that are with us. So the fact that we just have sort of a sense of family, a sense of community responsibility, and multiple generations that are working to make this a good organization is this thing that most stands out in my mind.
How do you think Dr. Leon's vision has been fulfilled at SDMI?
I think he did a really good job of it. I think, we've done a very good job of it. I think the whole team has done a very good job of it. I mean, Leon's major belief was that if you practice high quality medicine, the patients will follow. And we really still follow that philosophy to today. That everything is done here is to maximize medical quality and to maximize the patient experience. And I think we've continued to be successful as we open new offices, because when people come here, they see that, they experience it for themselves. So I think we really have fulfilled his idea of what the practice should be. And we continue to fulfill it, and that is really what we strive for every day.
How does leadership or the organization make sure that that message is believed by all of the team members?
I think it's very clear to everybody here that, quality is job one, and that we want to stand behind every team member.
Some of the buzzwords today that we hear all the time: mental health, work-life balance. How do you take care of yourself amidst running such a busy organization?
Oh, that's a challenge. I think I try to balance, family with work. I do try to take care of myself, and I try to take time to try to do a little bit of yoga every day and a little bit of cardio every day. But, it's still a busy, challenging life.
What advice do you have for patients?
Advice for patients, I'd probably say to be actively involved in your own health and your own health care. So try to lead as healthy a lifestyle as is possible, and don't be passive about getting medical care. Make sure that you're, doing your follow-up work. Make sure that your physicians understand your particular problems and are addressing your particular needs.
What has SDMI taught you?
Wow, good question. I think SDMI has taught me that, being a physician is a lifelong learning experience, and that you need to have a little bit of humility as a physician, and you really need to treat everyone that you work with respect and decency. I mean, I really think the sense of quality and the sense of family here has been a really useful learning experience for me.
I like to end everything with one final question. What would your younger self be most surprised by?
Wow. My younger self would be surprised by how hard I've worked and have continued to work.
Very good. Thank you so much for your time today.
You're welcome. Pleasure to be here.